Grand Rising, how is everyone doing on this beautiful what, Thursday? Okay, let's see what we have today. Bring the news to you. Okay, Biden's vaccine rules for 100 million workers are here. These I hope, can y'all hear me now? Okay. This is Biden's rules for the COVID vaccine for the workers. Deadline is January the 4th. The first rule is issued by the Occupational Safety and Health Administration, covers companies with 100 or more employees, applying to an estimated 84 million workers. Companies must ensure that their workers are either fully vaccinated against COVID-19 by January the 4th, or that they test negative for COVID-19 at least once a week. Now, I am employed, but I'm just on leave right now. And I would just choose to get tested every week. I will not take a vaccine, okay? You have choices. This is your body. You don't just put something in it, okay? I didn't even take I don't even take the flu vaccine. I don't, and never had the flu. Sure don't. I don't take something just to be taking it. Even cold medicine, I don't just take cold medicine until I actually catch a cold. I don't just take cold medicine. No one does that. Okay, so employers don't need to pay for testing in a move that appears designed to push workers to choose vaccinations over testing. The rule does not require employers to pay for or provide testing to workers who decline the vaccine. However, collective bargaining arguments or other circumstances may indicate otherwise. Unvaccinated people must wear masks. I so agree. I wear my mask when I step out that door and I'm going into other people's businesses. I'm wearing my mask because I'm going to protect me. Yes. A second rule issued by the Centers for Medicare and Medicaid Services requires some 17 million healthcare workers to be vaccinated by the same deadline, January 4th, but with no option for weekly testing in lieu of vaccination. Oh, that is not good. The rule covers all employees, clinical and non-clinical, at about 76,000 healthcare facilities that have federal funding from Medicare or Medicaid. But let me tell you something, they're dead wrong for that, okay? Because I work in healthcare, okay? I started out as a nurse. I majored in nursing. I was a BSN student. Then I switched my profession to clinical social work. So I'm still in the healthcare profession, okay? Yes, I am in the healthcare profession. I am considered a frontliner. But here's what I'm going to say here. We have dealt with sicknesses from patients way before this COVID came along. And what did we have to do? All we had to do was cover ourselves, put your mask on, put your gloves on, put your gown on. They never, ever had us to shoot ourselves up with anything to prevent us from catching anything from a patient at all. At all. So you healthcare workers should be speaking very loudly against this, okay? Vaccine requirements have proved successful, but a backlash is expected. It should be a backlash. It should be. In rolling out the new rules, Biden administration officials said vaccine requirements are good for the economy, and hailed the success of vaccine mandates. With only a small fraction of workers, sorry about that, I keep getting emails coming in, choosing to leave their jobs rather than comply. I don't blame them, because no one is going to force me to put something in my body to have a damn job. No, y'all know that's dead wrong. Okay, employers for Tyson Foods to the Houston Methodist Hospital system have reported vaccination rates topping 96%. But well before the details of the rules were released, there was backlash from Republican-lead states, with 24 state attorneys general threatening to sue the Biden administration. They ought to. In a letter addressed to Biden on September 16th, they warned that a vaccine requirement would drive further skepticism of the COVID-19 vaccines and cause some workers to leave their jobs, further straining an already too tight labor market. Because it should be a choice. If it's really preventing something, it should be a choice. If I say, for example, if I decide to take the vaccine, I'm not going to sit up here and worry about somebody else, because the vaccine is going to do what? Protect me. So what they're showing is really that the vaccine is not protecting anyone, and they just want everyone to shoot up. There's something more deeper that's really going on with this, okay? Okay, this week, the Biden administration was quick to lay out its legal authority in issuing the rule, citing the responsibility of OSHA has to provide workers with safe and healthy working conditions and to act quickly when workers are found to be facing grave danger. That's right. We always had to comply with OSHA, and that's just what I was referring to earlier when I said that we have always been faced with a patient that has some type of infection that could possibly affect you. So we also always had to cover ourselves up. If we had a patient that had an infection, they would have a note on that door. I learned this as a CNA. They would have a note on that door. So whoever entered, you know, to suit up. They never had us to inject ourselves with a damn thing. Sure enough. So they shouldn't be doing it now. A virus that has killed more than 745,000 Americans, with more than 70,000 new cases per day. And what's going on with this COVID is the plagues of the Most High. I don't care how many vaccines you take, you will not stop the Most High. That's how come they came up with this term called breakthrough, because this is the plague of the Most High. And the only way you're going to dodge his plague is repenting and worshiping him and not those idols that you're worshiping, that Jesus and whoever else you're worshiping. If you're not worshiping the creator of heaven, earth, the sea, and all that therein is, you can take all the vaccines all you want, and it's not going to do you any good. Any good. And the COVID virus is not the only plague. You got fires, storms, tornadoes, hurricanes, earthquakes. He's cleansing his earth by any means necessary. Okay. Moving along, the federal government is largely relying on companies to self-enforce the rule. Okay, first of all, the companies need the people. The people don't need the companies, okay? They're going to find out who needs who, because without the employers, that company is not going to run, okay? With only a couple thousand state and federal OSHA inspectors nationwide, there is no mechanism for checking up on millions of workplaces to see whether they are in fact keeping vaccination and testing records. Okay, so all I'm going to say is you have choices, okay? It's your body. You should not be putting nothing. Y'all know this is some serious times, strange times, but I know what time it is. So it's not strange to me. I know what's really going on. The Most High is cleansing his earth, and they're not telling you that, okay? And they think that they can fight against the Most High, and they want to take others with them, okay? That's all this is. That's what this vaccine is for, to take others to the grave with them, okay? That's what it is. Now, let me say this. The flu has been around for a very long time. How did they address the flu? You just get that flu shot, and guess what? It wasn't free, was it? So you know something is really going on with this COVID injection. It's free fall. Y'all better think. Okay. Okay, so y'all please like, share, and subscribe. Okay. So y'all like, share, and subscribe, and y'all please hit that notification button so you will be notified when I am dropping new videos. Shalom.